Thank you for the opportunity to share this paper with you. The title is How Congenital Zika Virus Impacted My Child's Functioning and Disability, a Brazilian qualitative study guided by the ICF. I want to mention that the first author is Taina Campos, and she is a master's student that recently completed the master, and this is the topic of her thesis, and she's from Brazil. I am Veronica Schiariti, and I am presenting on behalf of all the co-authors. Infections in pregnancy, including the most common congenital infections known as TORCH, are known causes of long-term neurodevelopmental disabilities, including cerebral palsy. The proportion of children with specific disabilities attributable to TORCH infections is 5 to 10%. Other less studied congenital infections like Zika virus have severe impact on brain development, most prominent microcephaly. A recent report published by WHO on an update on Zika virus described that infections with Zika virus continues to carry the risk of adverse pregnancy outcomes, including increased risk of preterm births, fetal death, and stillbirth, and congenital malformation collectively characterized as congenital Zika syndrome, including microcephaly, abnormal brain development, spasticity, eye abnormalities, brain calcifications, and other neurologic manifestations. The provision of long-term care of affected children and families remain a substantial need of healthcare systems and community-based programs. Accurate and up-to-date epidemiologic data on Zika are limited in many areas of the world, and there's a need for further understanding of its causal pathways, clinical presentation, and profile of functioning and disability. With the recent emergence of congenital Zika syndrome, several studies have been conducted globally with a heterogeneous range of outcome assessed. The Zika virus was identified in Brazil at the beginning of 2015. In Brazil, there are currently 3,400 confirmed cases of children with microcephaly and/or other neurological signs due to Zika, with a further 2,600 cases under investigation. The Zika virus outbreak in Brazil had devastating social, medical, and financial consequences so far. Many researchers and clinicians are now following up the children to understand the impact of Zika on child development, functioning, and disability. But outcomes measures are heterogeneous, and often it is not clear how meaningful they are to families and children. Creating a standardized core outcome set for Zika will reduce the heterogeneity of the studies and reporting bias and enable development of meta-analysis and data sharing between studies. The aim is to create cost guidelines for the assessment of outcomes, particularly related to the neurodevelopmental consequences of congenitally acquired Zika virus for global use. It is expected that patients and their parents or caregivers will be involved in the development of these sets of core outcomes in order to ensure that the research process is more relevant and appropriate to patients' needs. It is important to consider whether outcomes are being measured across the spectrum of the ICF. As you might be familiar with the ICF can be used as a reference for outcome selection, and you are seeing a representation of the model and the components, and in the center of the slide is the representation of the components included in functioning and disability, that is body structures and body functions, activity and participation, and those components, how they interact with environmental factors and personal factors. You can see how to use the ICF as a conceptual framework and representing what to measure, and you can see here some examples allocated to the different ICF components, and we're using this color coding all along the presentation. We're using here, and as an example, cerebral palsy, as there's a big overlap on the clinical presentation of congenital Zika syndrome and the spectrum of presentations in cerebral palsy. So the key question that we want to answer in this study is what to measure in congenital Zika syndrome from the parent's perspective. This study is part of the core outcome set study for Zika syndrome, and the specific objective was to identify parents' perspectives on relevant areas of functioning and disability, which should be included as outcome measures in studies with children with congenital Zika syndrome guided by the ICF. In this qualitative study, focus groups were conducted in 3 rehab centers in 2 regions in the northern regions of Brazil. The questionnaire was structured based on the ICF components, and the inclusion criteria consisted of being a parent or caregiver of children with confirmed diagnosis of congenital Zika syndrome by PCR and different diagnostic tests that are listed here. The age of the child from 0 to 5, and live in the area covered by the study and attending the rehab centers in those areas. You can see here some of the characteristics of the parents who participated in 6 focus groups. The majority were mother age from 20 to 30, living in urban areas, and most of them receive extra financial support. Regarding the characteristics of their children, the mean age of the kids was 32 months, and the standard deviation was 6 months. The majority of them were boys, and they had many comorbidities, vision, hearing, and sleep disorders. As I mentioned, the focus groups were conducted in the community, and there were 6 parents per group, and durated almost an hour and a half each of those. And the content of the all the transcripts were translated into the ICF language following ICF linking rules. This is a representation of the summary of the ICF categories that were mentioned by the parents. In total, 36 unique categories were mentioned, most of them representing the components of activity and participation, body functions, and environmental factors. We went beyond and assessed the frequency of the ICF categories, and we ranked the top 12, and these were the most frequently mentioned by the parents. And you can see that again there was a representation of different components: environmental factors, activity and participation, and body functions. But overall, the most frequent component represented by these categories was environmental factors. And this was mentioned as a barrier and also as a facilitator. Most of the barriers were related to access to services like therapies and assistive devices related to activity of daily living, mobility, communication, and activity and participation. Most of the areas were related to mobility, maintaining a body position, walking, use of hands. So those were the areas that parents representing as concerns or expectations, and areas that are of relevance for them. So in summary, our research identified what areas of functioning and disability parents of children with Zika syndrome consider important to them. And this information will contribute to the final core outcome set for congenital Zika syndrome. And although the parents did concentrate on issues related to movement abilities, overall their main concerns focus on environmental factors. And this is important because most of them are modifiable factors that could be the target for future interventions. We also learned that in Brazil, there's a little acceptance of disabled children for what they are within their context. So this shows that there is a need for actions, including education and advocacy at a local and national level, to change attitudes towards disability. So we are planning to start an educational campaign using some of the tools that are based on the ICF, like, for example, My Abilities First. Thanks for your attention. I'm looking forward for the questions.